Yes, PTSD, post-traumatic stress disorder, can mimic bipolar disorder, as the symptoms of these conditions sometimes overlap, leading to potential misdiagnosis. Below is an explanation of how this can happen and key differences between the two conditions. How PTSD can mimic bipolar disorder, mood swings. PTSD can cause extreme emotional shifts, such as intense anxiety, anger, or sadness, that may resemble the mood episodes of bipolar disorder, mania, or depression. Intrusive memories or triggers in PTSD can lead to emotional dysregulation, which can appear as highs or lows. Hyperarousal, resembling mania, symptoms of hyperarousal in PTSD, e.g., restlessness, impulsivity, difficulty concentrating, and sleep disturbances, can look like manic or hypomanic episodes. Risk-taking or hypervigilance might be misinterpreted as a manic state. Depression in both conditions, both PTSD and bipolar disorder, can cause depressive episodes marked by feelings of hopelessness, low energy, and withdrawal from others. Irritability and anger. PTSD often involves irritability or angry outbursts, which can be mistaken for the irritability commonly seen in mania or mixed episodes in bipolar disorder. Intrusive thoughts and rumination. The intrusive thoughts and flashbacks in PTSD can be misidentified as the racing thoughts seen in bipolar mania or hypomania. Key differences between PTSD and bipolar disorder. Triggers in PTSD. PTSD symptoms are often linked to specific traumatic triggers, whereas bipolar episodes typically occur without external events causing them. Duration of symptoms. In bipolar disorder, mood episodes last for days, weeks, or months. PTSD symptoms can fluctuate moment to moment depending on exposure to triggers. Manic symptoms in bipolar disorder. Bipolar mania includes euphoric moods, grandiosity, and excessive energy, which are less typical in PTSD. PTSD rarely causes elevated or euphoric mood, a hallmark of bipolar mania. Nightmares and flashbacks. Nightmares and vivid flashbacks are specific to PTSD and are not common in bipolar disorder. Sleep disturbances. Both conditions can cause sleep problems, but in PTSD, insomnia is often related to hypervigilance or trauma-related nightmares. Can they co-occur? Yes, it is also possible for someone to have both PTSD and bipolar disorder. Trauma can exacerbate mood instability in bipolar disorder, and people with PTSD are at higher risk for mood disorders. Diagnosis and treatment. Proper diagnosis requires a thorough assessment by a mental health professional who considers personal history, symptom patterns, and triggers. Treatments differ significantly. PTSD is often treated with therapies like cognitive behavioral therapy or EMDR, along with medications like SSRIs. Bipolar disorder typically requires mood stabilizers or antipsychotics to manage mood episodes. If you or someone you know is dealing with these symptoms, consulting a mental health provider is essential to ensure proper diagnosis and treatment. So my therapist thought that who did EMDR on me for years, thought that I was the worst PTSD victim she'd ever treated. So my PTSD could mimic bipolar disorder. Instead of me having bipolar disorder, I might not have bipolar disorder at all. Instead, I just might have PTSD. And then I have a dissociative spectrum disorder, depersonalization, derealization disorder to go along with my complex PTSD. So I might not even be bipolar. I might just have PTSD, and since I'm the worst PTSD victim she's ever treated, out of all the hundreds of patients she's treated, my PTSD might just mimic some of the bipolar symptoms. So I might not need medication at all. I just might need more EMDR therapy.